Hello, everyone. Welcome to another episode of Dr. Plano's Plastic Perspectives. Today is December 13th, and I am Dr. Jeff Angobaldo, a board-certified plastic surgeon, otherwise known as Dr. Plano. In today's plastic perspective, we'll be focused on a tummy tuck, otherwise known as an abdominoplasty. A tummy tuck is a cosmetic surgery that's designed to improve the appearance of the lower third of the abdomen. That's usually damaged with weight loss, or having children, or just genetics. The surgery is a three-part surgery. We excise the lower third abdomen skin and fatty tissue. We also repair the diastasis. Tummy tuck is a three-part surgery. The first part is that we take out skin and fatty tissue from the lower third of the abdomen. We also liposuction the sides. It's called the flanks, anterior and posterior, like the lower back region. And the last thing, and probably the most important aspect of the tummy tuck, is to repair the diastasis. That's a separation of the abdominal muscle along the midline. Usually will occur with pregnancy. That means that if you're seeing a patient or someone that has, she's very self-conscious after children, she looks pregnant when she wears a dress, that is a separation of the muscle. And that's a really nice, intricate part and important aspect of the tummy tuck surgery, is to repair that diastasis, bring that muscles towards the midline, and they look very flat afterwards. So as we discussed, the tummy tuck, it creates a very flat, a very toned abdomen, and that's just the excision of the skin and the muscle repair. The liposuction on the sides really contributes to the hourglass shape and narrows the waistline. It's been shown that when you repair the diastasis muscle, that there's two medical benefits to it. It's not only a cosmetic procedure that helps flatten the abdomen, but it's also been shown to help with two things: back pain and urinary incontinence that can happen with just children or with age and time. I believe, from my perspective, the back pain is improved because the posture is improved. It's like having a corset. It helps improve the posture by straightening your back more. But that's the two instances that it's shown in our research that it's helped our patients. The biggest thing is, for our patients getting these procedures is the restoration. They're confident. Their self-esteem is high. You're kind of given, pregnancies, weight loss really destroys that abdomen. With that rapid stretch marks are created, and you can't work out that loose skin. It's permanently damaged. The only way to excise that, the only way to treat that is to excise that tissue. So, it's a big boost in confidence when they look flatter than they did before children. And obviously, if you're correcting and contouring their trunk, which is the abdomen region, and the flanks, it really gives patients confidence. They look better in their clothing. Everything fits better. Their waistline has gone down. Just in doing this for over 15 years, I've noticed that with tummy tucks, it depends on how full someone is at the flanks. They'll go down between 1 to 4 pant sizes. The final results take about a year. But at 6 months, they look really good. 80% of the swelling is gone. They look great in bathing suits. They've gone down a few inches, and they're super happy and content. So that's why we love doing this in plastic surgery, because it makes people happy. That's why I went into this field, and that's why most of us have. People always ask, how long do tummy tucks last? And it's one of the few surgeries in plastic surgery that the tummy tuck results will last your entire life, unless you gain a lot of weights and lose it, because that can affect your skin tone, or if you get pregnant after a tummy tuck. So a lot of our patients usually are in their mid-30s to early 40s, and they've already had all their children. They don't want any more. Or they're younger and they've had significant weight loss, like over 70 to 100 pounds. And yeah, so it really, really improves someone's self-esteem and confidence. People think that, you lose a lot of weight with tummy tucks, you do to a certain degree. Tummy tucks can weigh between 1 to 4 pounds. And believe it or not, a liter of liposuction might weigh a pound. There's not much weight loss with cosmetic surgery, but they have a massive improvement in their shape. They have more of an hourglass shape. Their waist is down a few sizes. They look great in clothes. But really, it's not really, you don't look at a tummy tuck as a weight loss solution. There are complications with any surgical procedure. All of our patients sign the American Board of Plastic Surgery consents. We also review that at the pre-op. Even at the consultation, we'll discuss some of the complications that can occur. But complications that's why you go to a board certified plastic surgeon, because we can treat our complications. And there's always, an answer. There's always a solution. Infections rarely happen in cosmetic surgery. What is a complication that I worry about is a blood clot. It can affect 1% of tummy tuck patients. So some patients are at higher risk. They'll receive a blood thinner for 5 days. But that can occur, the blood clot. Bleeding can also occur, which is a hemorrhage. That means that maybe the blood pressure is elevated and there's a little pocket of blood that occurred. And that happens. It's very infrequent, but it can happen. A seroma might be a little more common, and that's basically body fluid. If you're too active after the surgery, you may generate some fluid that needs a needle to aspirate it. So the key is to always follow your doctor's instructions. And the instruction in the first 2 weeks for the tummy tuck is pretty much no activities. You're not cleaning, you're not cooking, you're just kind of resting. And you're getting up every 2 or 3 hours to walk around for a few minutes. As the weeks go on, you can do more activities, but you're not released to exercise or perform all your daily function activities, the laundry, the deep cleaning, for at least 6 weeks after surgery. It's a very similar recovery to a C-section, and patients are wearing a binder and a compression garment a week later. That helps control the swelling. And most patients can return to work at 10 days to 14 days. But I must say, I always tell my patients, if you're able to, take 3 weeks off. And the reason why is, you can go back to work in 2 weeks or in 10 days, but really after lunch, you get into like a food coma, and it's tough you feel like sleeping more than working. So if people do return to work within 10 days, or it's 14 days, well, I'll always say maybe you can work part-time for the first week. The 3-week mark is a huge turning point, because people can work all day and they can do some activities in the evening, cook, some mild cleaning, but nothing too strenuous on the body. Scarring is something that we also deal with a lot in plastic surgery. A lot of it is really controlled by genetics. But people that have unfavorable scars, that's an important discussion, because scars it's not thick, there's no color to it. It's a perfect closure. And if you're very fair complected, the closure turns reddish. And if you're my complexion or darker, you end up with brown scars. Right? The color, it starts around like the 3 to 4 week mark. So either way, scars change from head to toe for 2 years. So it just takes time. And some folks turn white. Their scars go from pink to white within 3 months. It's all about genetics and how people heal. But there's always a light at the end of the tunnel, because there's treatments for it. We have scar lasers. We also have bleaching creams for the darker scars. And patients are always recommended to use silicone sheets starting at 4 weeks. Silicone sheets are one of the few things that can prevent a scar from getting thick. And they're wearing these silicone sheets for literally 23 hours a day for a long time, at least a year. And if a scar gets thick, they usually have to come in, because we can also inject a little bit of steroid called Kenalog into the scar itself, just small amounts. And that really stops the process from getting thicker. Now, if a person doesn't show up for a year and they come in with a thick scar, that's when it's a little bit more complex. You have to actually do a full scar revision and restart from scratch. But scars don't happen too often. But that's why any complication that people can occur can go back to their doctor. And that's why you choose a board certified plastic surgeon. One of the things that we do see are that can occur are wounds or rejected sutures that can occur that creates a wound that lasts for a couple of days and heals. You know, so to try to prevent wounds from happening, we always tell our patients, a few weeks in advance to eat a high protein diet. Normally you need 30 grams. We will tell our patients maybe start taking about 100 to 120 a day. A multivitamin, vitamin C, zinc, and even iron, all that helps contribute to good wound healing. If a patient's on let's say a medicine for an autoimmune disease, they usually have to see their doctor for when they can hold it off. Normally it's about 4 weeks, 4 to 6 weeks they hold off any immune suppressant medication. To also minimize any complication, all of our patients see their physician for clearance. I can clear patients as a physician, but we don't have the labs or EKG machine that my primary care physician has. So everyone sees their doctor for clearance, and they fax us that information, and then I review it, and they usually end up being cleared afterwards. There's always risk with anesthesia, and sometimes some people get wounds, and wounds are one of those things that can be really affect the patients, because no one wants to have a complication. And if a wound occurs, when we have a patient with wounds, we'll see them every week until they heal. And so we always give them a lot of reassurance that this will heal. And if it forms a funny scar, let's say a wide scar or an indented scar around the wound, once it's healed, we can always revise it. And that only takes a few minutes in the clinic. But we always want to wait till after everything heals and wait a couple of months. Other things, like asymmetries, that can occur. It's never a perfect science. No one can make anyone perfect because we're completely different. One side of our body is different from the other. One hand is longer. One side of your face has more muscle, more bone. And, if it's all true, like you can do measurements and look at your feet, you'll see 1 foot's longer. So half our body divided down the middle is different, and no one can make and match someone perfectly. So it's always key to have realistic expectations of any cosmetic surgery. The results of a tummy tuck last your entire life. It's very long lasting. But we always tell our patients with any cosmetic surgery, normally if a female gains weight, it can go to several areas of the body. It can go to their breast, their thighs, but a lot of times it goes to the flanks, the sides, and the lower third of the abdomen, that skin apron that we excise. But we're lipoing that area, the flanks. We're excising that lower third loose skin, including the fatty tissue. Sometimes they can gain weight in the visceral cavity. And what is that? That's your guts, kind of like a guy's beer belly. So it's that hard belly. When you see let's say a male who's a little bit heavier, they're all belly. You touch it, it feels like it's hard as a rock. That's all visceral fullness, and you can't lipo that area. That's just diet and exercise. So when a female gains weights after a tummy tuck, they can gain it in the visceral cavity, and they look a little pregnant in tight clothing. So we always instruct all of our patients not to gain, more than 5 or 10 pounds. From my experience, my patients do very well for a couple of years, but it's about 5 or 7 years later is when they start to gain a little bit of weight. Not all gain weight in the visceral cavity, but if that happens, having visceral fat is not a healthy thing for men or for females. So remember that. Don't gain too much weight with a tummy tuck. Over time, some patients ask why they're a little numb. And initially, when you're cutting all of that skin, there's nerves in the skin or in the fatty tissue layer. So all that gets removed. So initially, people are very numb throughout the central abdomen. But over the next 6 months to a year, sensation comes back. And there may be an area that might be permanently numb, and that's about 1 centimeter around the scar itself. So if there's any permanent numbness, it's right around the scar. That's usually after a year if there's no sensation in that area. So the biggest impact I think for patients is just, I think psychologically they feel confident, so, and they're happy how their clothes fit them, how they look. Uh, and so you're kind of restoring, giving back, what the, their weight loss gave them, or having children, how that affected their skin. So, that's why we do it. It makes people happy and it makes them confident. Always make sure you choose a board certified plastic surgeon, and always follow your doctor's instructions. And always maintain a healthy lifestyle, avoiding like nicotine, vapes. And so, and you do that and you follow your instructions, you'll have very good results. So that wraps up our podcast. I hope you learned a lot about tummy tucks today, and thank you all for listening. You can follow us on social media. It's Dr. Plano. And if you're interested in a consultation, you can call 972-378-3870. And don't forget, we have our holiday specials all throughout, up to the whole month of December. So if you're new to us, come on in. Take care.